Good morning, everyone, and welcome to our webinar on IPM performance for the month of December. We are having very interesting topic today. The first topic, the different topic that we take every month. We will be focusing on the Indian pharma market, highlights of 2025, and what does year 2026 has in store. Just a minute. Yeah. Followed by that, we will be looking at our usual sections of IPM therapy performance, growth drivers, top 40 corporates, top 40 brands, and key takeaways. So, to start with, first we will discuss the approach that we had taken while working on this analysis. Okay. We have looked at the COVID normalization which has happened across the different therapies. We have looked at the therapy behaviors after launch of new molecules, innovators, as well as the incremental changes that may have happened in the market as far as the brands or composition is concerned. Molecules going off patent, what has been the impact on the innovator brands as well as the branded generics which have come in the market. Policy impacts also, as well as certain bans that may have happened. Additional aspects that we looked at while understanding the highlights for the year, we looked at the generics and online sales shifts, the impact of partnerships, mergers, acquisitions, increase in awareness, hence uptake of certain indications, uptake in certain indications like obesity, changing demographics, environmental effects, governmental interventions, and disease patterns, and also shift in focus from mass market brands from RX to OTC or OTX. Also, we studied certain long-term trends in terms of uptake, consumer behavior, growth trends over the last 4 to 5 years to arrive at this analysis. And based on this analysis, we have arrived at the three scenarios, the optimistic, realistic, and pessimistic scenario in terms of growth and performance of the Indian pharma market for the year 2026. But even before jumping to how the market will behave next year, we thought, or in 2026, we thought about let us look at what we had predicted last year about the year 2025 and how we have behaved or how we have fared against the prediction that we had done last year. In fact, it is more or less aligned with the market reality. I'm not sure how many of the people attending this session or going through this session have had a chance to look at the market compass report that we had released in December 24 based on November 24 data set. In that, we had done same three scenarios, optimistic, realistic, and pessimistic scenario on how the market will behave based on November data set. We had looked at what could be the market value in 2025, what would be the growth driver breakup, the volume growth drivers, the price driven growth drivers, and the new product growth drivers. And based on this, we had arrived at three scenarios. Optimistic growth we had predicted as 9%, realistic as 8.2%, and pessimistic as 7.4% for the month of MAT November. So this is the realistic forecast. So these amongst the three scenarios, I'll focus more on the realistic because we are very close to the realistic forecast that we had done same time last year. This was the forecast that we had done as far as the growth is concerned and breakup of the three levers of growth and actual MAT November value as it would be seen. And this is the actual value that has come out after the release of November dataset, wherein as far as the growth is concerned, the growth drivers are concerned, and the value is concerned, we are very close to what prediction we had done 1 year back. Also, when we had studied this analysis 1 year back, we had used the same parameters that we had looked at the approach. Of course, there will be certain disruptions, like certain markets like anti-obesity, where the performance was much more than what was expected, but then to a great extent we are in line with what we had looked or predicted the market to behave. Now coming to what we will be doing in today's analysis, we will not just jump on the numbers, but we will look at how the different markets are behaving or have behaved in the last 5 years, in the last year 2025, and why this behavior has happened and what can we predict in a fortune in a you know what can we predict in terms of how the market will behave in the year 2026. Coming to the first segment, the cardiac segment, which is the biggest and the most important segment in the Indian pharma market today. We look at the therapy performance across the different sectors, sub supergroups within the cardiac segment. Interesting part is if we had looked at this table probably 10 years back, antihypertensives was actually more than 60% of the cardiac market. If you look at it today, antihypertensives is 50% of the cardiac market today. While the overall cardiac market has grown significantly, the contribution of other therapy areas has actually increased, indicating it's not just age-related hypertension which becomes the core of the cardiac category, but there are some other segments also which become important. So if I want to talk about the therapy highlights of the cardiac segment, it is the strongest therapy performer, having a double-digit 5-year CAGR, as well as the current year's value growth is also double-digit. Recent acceleration due to India's rising NCD burden, especially the hypertension, dyslipidemia, and heart failure, earlier diagnosis, younger susceptible age group, and longer term duration, they have actually pushed the growth of this market. All the segments within the cardiac category have shown strong growth, whether you're looking at a 5-year CAGR or whether you're looking at the MAT growth. Everywhere or most of the places, the growth is double digit. Also, when it comes to ailments of heart, people are extra cautious, prefer to go to a specialist, at least, if not a super specialist, at least to a specialist, and compliance is relatively stronger. So, this is driving the growth of the market again. As far as the new introductions are concerned, there are 6 new introductions that have happened in the market. And if I were to talk about a futuristic note for this market, this therapy will growth will stay robust. It will be led by increasing prevalence, stronger diagnosis and awareness of the heart disease conditions, and a younger risk population. Coming to the next biggest therapy, the gastrotherapy, which is more of an acute therapy. If you see in the gastrotherapy again, antacids are the highest contributing segment. However, there is a lot of more fragmentation in the gastrotherapy as compared to the other therapies. Now, in the gastrotherapy, what we see is the pandemic era spike, especially in the antacids and the probiotics, which was seen, which led to a higher CAGR. That spike seems to have normalized. That's the reason why over here, though the 5-year CAGR is on a higher side, the current MAT growth is single digit. There is a lot of OTC nature which is coming into these growths into this segment, and there is a lot of generic crowding that is happening in this market. Gastrotherapy is mostly a acute therapy, depends on seasonality, and that's the reason why the consumption is also episodic. That's the reason why this therapy may not show a very high double-digit growth going forward. As far as new introductions is concerned, there are 6 new molecules that were launched in this market. Though vonoprazan was launched in 2024, this molecule right now is a 200 crore plus segment, which has done fairly well. Coming to a futuristic note, the gastro category is a mature category with growth largely influenced by its acute usage pattern and seasonal demand. Coming to the next category, the anti-infectives category. If I were to look at the therapy performance over here, antibacterials is the highest contributing segment. Uh, okay, is the highest contributing segment. And before even I go into the therapy highlights, I would like to focus more on the 5-year CAGR and the current growth of the market. In the COVID times, it was the antifungals and the antivirals which had a significant growth, especially because of COVID, where we had this favipiravir, remdesivir, which was driving the growth of the antivirals market. When it came to antifungals, it was your voriconazole, posaconazole, which were, conditions which were coming with COVID. And they had driven the growth of the market. With COVID era going down, the growths have gone down significantly. Whereas if you were to look at the normal antibacterial segment, the growth is steady. The 5-year CAGR is also 6% and the current MAT growth is also 6%. Now, what is happening in this anti-infective segment? There is a good amount of focus on using the right antibiotics at the right dose for the right duration in the right patient. The goal of the country is to reduce the antimicrobial resistance. If you see, when you go for asking for an antibiotic, usually you are asked for a prescription. At least that is my experience. I do not get an antibiotic without a prescription in my locality. And even if the product is not available, it is not in stock. And if I ask the chemist to give me a replacement or a second brand with a similar composition, the chemist usually refuses and he actually tends to give me only that brand which is mentioned in the prescription. There is a lot of shift towards targeted therapy and diagnostics in this therapy area. Because of this focus, there is a lot of scrutiny on irrational combinations. Generic penetration is also on a relatively higher side. And if I were to further break down the growth of the antibacterial segment, what I see is the hospital anti-infectives have shown a relatively stronger growth as compared to the trade anti-infectives. Because if there are certain surgical procedures and anti-infectives have to be given, they will have to be given. Whereas as far trade is concerned, rampant usage of anti-infectives or antimicrobial products is now curbed. Even if I were to look at the new introductions that have happened in the anti-infective segment, if you look at the type of molecules that have got launched, most of them belong to the hospital anti-infective segment. If I were to look at a one-line futuristic note, restrictions on antimicrobial overuse combined with seasonality may constrain the category growth. So like gastro, anti-infectives category also would be a relatively slow growth category this year. Coming to the anti-diabetes segment, this segment is more talked about because the initial innovations that had happened because the DPP-4 and SGLT2s that had come in the market, and today the anti-obesity drugs, which are again increasing the noise levels and awareness about health in this market. Now we have GLP-1 agonist as a separate section altogether. If you look at the anti-diabetes segment, the 5-year CAGR is quite good and positive. For the combinations, the growth is 10% at a 5-year CAGR level, whereas the MAD growth is also quite robust. However, if you look at the GLP-1 agonist, the growth is really very high and it has been fueled by certain new introductions that have come in the market and have revolutionized the market as far as the anti-obesity treatment is concerned. We will look at obesity section separately, not combine it with the anti-diabetes segment. Coming to the therapy highlights, there is an expanding patient pool. There is earlier initiation of the therapy because since there is a lot of noise levels about blood sugar level, monitoring blood sugar level, the side effects of not controlling or unwanted effects of not having a good control over sugar is something which gets talked quite frequently. Insulins, OADs, and newer combinations are driving the value of this market. The newer classes like GLP-1s, DPP-4 inhibitors, SGLT2 combinations, and branded generics are driving the incremental growth of this market. While majority of the DPP-4 or majority of the blockbuster DPP-4s and SGLT2s have not now gone off patent, a good number of combinations of DPP-4s, SGLT2s with glimepiride, with metformin, or DPP-4 plus SGLT2 plus glimepiride or metformin are coming in the market. And that is what is, and most of these branded generics have got their convincing storylines because of which even this market is picking up well. As far as obesity is concerned, it has become an established condition with focused attention due to launches by Novo Nordisk and Eli Lilly. And they have also expanded their presence in the last quarter of 2025 by partnerships with some major Indian companies. And we also are going to see a lot of generics also coming into this segment in the month of March this year. In fact, what happens is while most of us feel that being a slightly overweight or little obese is not an issue, but then if I were to look at what it is seen is majority of the people, mostly the urban population, have grade 1 or grade 2 fatty liver. Accumulation of fat on liver increases insulin resistance and makes it harder for the body to control blood sugar. That is what is a concern. So early detection is important. While we feel we are healthy, probably a checkup helps. Also, because there is a lot of focus in the anti-diabetes and obesity market, you will see maximum number of new launches have happened in this segment. of which terzepatide would be a sort of, a plain molecule, which is a newer molecule, but otherwise, most of the places it is combinations. This month in December 25, we have seen launch of fast-acting soluble neutral insulin as well. If I were to talk about a one-line futuristic note, the category's growth engine is clear. Anti-diabetes delivers scale without major innovation. Most of it is combinations of the existing of patent molecules, while anti-obesity delivers both innovation and volume. The next section we will focus slightly on the anti-obesity segment. So this is what the GLP-1 agonist market was. So the top blue line is the GLP agonist market value trend. If you see typically, the market had a very steady. In fact, these molecules, dulaglutide, liraglutide, lixisenatide, exenatide, were there in the market for quite some time. But then the market was very slow. The momentum was gained in 2022, where Ribelsis was launched in the year in Jan 2022, and it significantly expanded the awareness and acceptance of pharmacological obesity management. So Novo Nordisk was a company which actually initiated the creation of awareness and interest in the treatment. Later on in this year, in the year 2025, injectable semaglutide and tirzepatide were launched, which enhanced the dosing convenience and clinical efficacy. Besides this, there was a lot of market priming and physician education effort, which was done by both the innovator companies much ahead of the launch. That's the reason why the moment the products were launched in the market, they were accepted. Wegovy was launched first by Novo Nordisk, and Ozempic has been launched recently. This category is a predominantly premium category. At the time of launch, price of a quick pen or pre-filled syringe was somewhere, in the range of 10,000 to 15,000. That's the reason why the segment has shown a rapid value growth, while volumes, they remain measured. It reflects the pricing and the access dynamics in this segment. Now, in the last quarter of 2025, we have seen strong strategic partnerships, Novo and Eli Lilly partnering with Emcure and Cipla respectively. Also, there has been certain select brand economization where, certain brands came down on their pricing. This has improved the penetration and accessibility. As far as the partnerships are concerned, these partnerships are very recent. Europic was launched somewhere in the month of November, whereas Ozempic and Poviztra were launched just 10-15 days back. So right now there is a lot of pipeline filling that may be happening in the market. Probably Jan or Feb data sets would be the right data sets to see how the partnerships have impacted the overall obesity market. Also, if we were to talk futuristically, in the year 2026, how do we see this market shaping up, especially after branded generics would be entering the market in March 2026? Historically, when a branded generic comes in the market, it is launched at 20 to 35% of the innovator pricing, and it triggers close to 2 to 5x surge in the unit consumption over the initial 2 to 3 months. This phenomena is expected to repeat even in the anti-obesity segment. Now, this also depends upon the degree of price economization that happens at the time of launch. This statement is important because Wegovy has taken a price reduction 2 months back, which has impacted or positively their patient uptake. Also, Ozempic was also launched at a slightly lower price. So when it comes to branded generics entering the market, how much low can they go on pricing to ensure patient reach as well as their own profitability is important. While volumes are expected to accelerate, value growth is likely to moderate post entry of the generics as there will be a significant price erosion in this market. Some of the companies which are well positioned to leverage this opportunity are DRL, Cipla, Sun Pharma, Natco, Mankind, Biocon, Lupin, and Zydus Life Sciences. In fact, there may be more players because these are the prominent players that I have heard of, but then there will be few more players in the line to leverage this anti-obesity market opportunity. Coming to the next segment, we look at the nutritionals category. Again, acute category which had gone or zoomed into prominence in the COVID times. If you remember, Zincovit had become, because of its name, zinc and vitamins, it had become the number one brand in those times. And in COVID times, in fact, the entire nutritional category before the launch of vaccines had become important because people were more interested in boosting their immunity. That's the reason why we see a steady or a strong 5-year CAGR in this market, which has now slowed down. The therapy highlights in this segment are the COVID-driven boom, which was in 2021 and 22, was there, and now it has corrected. There is a lot of competition in this segment. There is a shift towards consumer health formats, a pursued shift from purely prescription driven models towards self care, OTC, and wellness oriented consumption. Now, what had happened in COVID is people had understood that zinc and vitamins are needed to, take care of your immunity. Some people actually continue taking this type of medication post COVID times. Also, a lot of noise level has got created about zinc, multivitamins, nutrition, and prophylactically being, safe in COVID times. So that's the reason why a lot of OTC component, wellness oriented consumption has increased thanks to social media and a lot of social media influencers who actually teach you which type of medication needs to be taken for different type of conditions. It's actually become a challenge. So growth is now split. Prescription vitamins are slowing, whereas nutraceuticals and D2C brands are absorbing the demand in this market. Social media influences, social media is influencing or triggering the consumption in this market, and which needs a caution, because we have also seen recent cases wherein we have looked at certain media personalities consuming nutritional therapies, probably not guided in a proper way, leading to fatal what to say results. So while nutritionals are is an important category, having the different components in the right proportion and as per your body requirements becomes very important. Medical nutrition still supports the baseline growth. The reason is there will be certain conditions like a patient is hospitalized and needs certain type of additional nutrients to be taken externally. So that category would remain stable and continue to grow as per the demand. No major new launches have happened in this segment. There was just one combination that has come, and that too is just a combination of many things. So in this nutritional category, there is no new molecular innovation, but a combination innovation that can happen in this market with a properly connected storyline saying why this combination becomes important. While self-care demand remains strong, social media and wider channels of reach, or wider channels from which the patients can buy this product, they are expanding purchases beyond doctor-driven prescriptions in the nutritionals market. Coming to the next category, the respiratory category, which has actually become a very important category in the last second half of this year, especially due to pollution driven problems. Let us look at how this category is going to behave in the year 2026. So if you look at anti-asthma products, they contribute to close to 60% of the respiratory category. COVID times, or not COVID times, 5-year CAGR is 10%. In fact, this year's growth is 11%. So this year, the growth for the respiratory anti-asthma category seems to be much higher than the previous year's growths. This is also connected with your systemic antihistamines and nasal preparations, which are more connected with the anti-allergy, or running nose, sneezing, which is accompanied with problems of pollution. So these categories also for this year have shown a steady growth. Whereas if you look at the cough and cold market, the growth is quite steady. So chronic respiratory burden rising due to air pollution and urban lifestyle. And when we talk about all this pollution, if I were to blame pollution, I may not always blame it to one or two factors. There are several factors which lead to pollution. Infrastructure development, focus on increased production, rapid urbanization fuel the pollution problems. If you look at a city like Mumbai, there are so many vehicles running on the road in the peak hours, not peak hours, throughout the day, in metros like Mumbai, Delhi, Bangalore, which actually leads to a lot of vehicular fuel pollution. Then there is a lot of infrastructure development happening in key metros, which add to the pollution. So all these factors, so development of a nation also comes with these additional, what to say, concern areas that need to be addressed parallelly. Inhaled corticosteroids, LAMA-LAMA combinations are gaining traction in the respiratory category. Seasonal infections add volatility, but baseline demand remains strong. Why do I say it adds volatility? Is in the earlier days, the months of certain seasons in certain geographies were fixed. It would be a plus or minus 5 to 10 days deviation. But today, if you look at the seasons, the timing of the seasons has changed completely. So it's not a plus minus 5 to 10 days deviation, it's a plus minus 1 to 2 month deviation. So we are not sure when the monsoon would start and when it would end, when the winters would start and when it would end. That's the reason why seasonality has also, become little volatile. But then the demand, I mean, even if the winters shift from by 2 more months, but winter related conditions and medications would still have a demand after 2 months down the line. 5 new molecules and combinations were launched in this market in the last 2 years. A season and environment driven category. The respiratory category is a season and environment driven category and should continue showing strong performance in pollution driven therapies, because solution to pollution driven related problems would not come in a year. It would take consistent efforts by the nation as a whole, not just government measures, but also everybody needs to own this responsibility of controlling pollution. Coming to the pain and analgesics market, if I look at this paracetamol and combinations with paracetamol, the biggest section in the pain and analgesics market. While the growth was higher in the COVID times, now the growth has slowed down. High growth earlier due to post-COVID mobility and surgeries, and that has got now normalized. Recent slowdown due to OTC dominance and in the NSAIDs market. There is a tighter prescription of opioids, so you cannot easily prescribe opioids anywhere and everywhere. It may be limited to certain surgical procedures or extreme cases of pain. Acute nature of this therapy limits sustained momentum. So unlike cardiac or diabetes category, where a person once put on the product stays on the product for the longer time, this category doesn't see that nature. Specialty pain therapy continues to grow, where the short time acute category may not show that type of growth, but then areas like osteoarthritis, rheumatoid arthritis, gout preparations, they are the ones which would continue to grow, because it again depends upon the incidence and prevalence of the condition. Monoclonal antibodies, which are targeted therapies, they are gaining prominence. If you see, though the market is a 278 crore market, at a 5 year CAGR, it has grown well, and even in the current year, the market has grown by 40%. This mainly we had, if you remember, we had done an entire IPM diary on biosimilars, wherein we had talked about the importance of monoclonal antibodies and the extent to which great relief the patient gets with these drugs. General ailments see steady season-led demand supported by OTC purchases, while specialty conditions sustain strong underlying demand for this segment. Coming to the neuro-CNS category, again a category which is quite fragmented. However, anti-epileptics, antidepressants are the core, and drugs for neuropathic pain, they are the strong contributing categories. Now, if I were to look at the growth of this market, there is a rising mental awareness coupled with willingness to onboard for treatment and have long-term adherence in this market. Now, if you look at the 5 year CAGR, all the categories within the neuro-CNS category have grown double digit. In fact, COVID has triggered the consumption of neuro-CNS drug. In COVID, because there was a lot of isolation, lot of pain or mental pain because of loneliness or loss of near and dear ones, medications which are more utilized or used in the neuro category actually have shown a good growth. In fact, if you see antidepressants, they have shown a higher growth. Antipsychotics had shown a higher growth. In fact, what we have also understood in COVID times, that earlier getting treated for these conditions was considered to be a taboo. But today, people open up. They are actually willing to accept their case of neurological or psychological problems, go and discuss with the doctor and get treated. There is an increased diagnosis of depression, anxiety, epilepsy, and advanced age related mental conditions like dementia, Parkinson's, and Alzheimer's. Now, earlier, dementia, Parkinson's, and Alzheimer's were considered to be conditions which come with age and it's natural. While medication cannot cure these conditions, but medication can definitely arrest the progression of these conditions. So, and many of the senior patients or younger adults take their parents for treatment of these conditions, and which is a really positive sign. That's the reason why, if you look at the growth of certain conditions like Parkinson's, Alzheimer's, at a MAT level, the growth is good. Even at a 5-year CAGR, the growth is double digit. But even at a MAT level, the growth of these categories is good. Also, since India's population is aging, the uh, the patient pool for these type of categories is only going to expand over a period of time. 5 new molecules or combinations have been launched in the market in the last 2 years. Neuroscience is one of the most underpenetrated chronic segments with growth driven by aging population, increasing lifestyles, and the shift toward nuclear families, which actually leads to less mental or psychological or empathetic support, which one needs in cases where you are depressed or under stress. That's the reason why this category will be growing relatively well in the next this year and also in the next near future. Coming to the derma category, if you look, Cosmoderma is one of the strongest section in this category. In fact, if you look at the derma category in COVID times, actually post COVID, this category showed a significant surge because work from home in majority of the cases was over. People were moving out, and that's the reason why self-care products, actually the consumption of self-care products increased post COVID, whether it was Cosmoderma, emollients, hair care, demelanizing agent. All these agents actually showed a very good growth in the post COVID times. And in certain categories like Cosmoderma or hair care products, anti-dandruff products, the growth actually continued over a period of time. Now, thanks to COVID, the focus has now significantly shifted, or for many categories, there is a significant shift to a OTC, or online purchase, and not all categories, a few categories, especially in derma category. um, there is a good OTX nature that has come into the picture. Now, RX trade momentum for certain products like emollients or hair care products may have come down. However, there are certain premium brands which still need a strong physician support, and they have a OTX nature. So the physician prescribes it, and then there is a repeat purchase. Social media, quick delivery platforms, they are nurturing smaller players who actually don't have a significant presence, but they are locally present in certain cities and ensure availability. They do not venture into many specialty molecules. They may just have certain products in, say, hair care, shampoos, anti-dandruff, or fairness creams. But then they are highly local players, and they really don't need a huge field force or what to say, foot on the field to get these sales. Social media helps them a lot, and of course there are many social media influencers as well. 2 new molecules combinations were launched in the this category in the last 2 years. Derma category is a stable but a competitive therapy. In this category, what we have seen is branding, noise levels, and visibility matter more than the molecules. Coming to the gynec category, if you look at the gynec category, it is the hormones other than contraceptives and infertility treatment which are the strongest category. In fact, in COVID times, childbirth was something which was postponed by many couples. And then after COVID danger was out, there were many childbirths that happened in this market, which actually led to the boom in the infertility treatment. Now, that is the reason why if you see now, this growth has been stabilized. There was a strong earlier growth due to fertility and PCOS focus. Now it has slowed down due to therapy saturation. What do we mean by therapy saturation is most of the patients who are eligible for this type of treatment have taken this treatment. That entire backlog has got filled, and now the consumption would be as per the market demand for that year. High dependence and doctor advocacy is very important in this sector. There were four new molecules that have got launched in the gynec segment. The gynec segment is a stable and a slow growth segment which will continue to grow at this stable trend. Coming to the blood related segment where anti-anemics are almost 70% of this market, if you see the growth, whether it is a MAT level or a 5-year CAGR growth or MAT growth, it is almost the same in majority of the cases. Improved diagnostics leading to higher detection of anemia and thrombosis has been seen in this category. Hospital-driven growth in iron sucrose, anticoagulants, and plasma products has been seen. Public health and private prescribing both are contributing. If you look at conditions like anemia, nutrition in children and women, is something which actually comes under public health initiatives in most of the states. And then, this section also gets addressed through this public health initiatives. No new molecules have been launched in this segment in the last 2 years. So this would be a strong category with a stable growth in the next coming years. Coming to the anti-neoplastic segment, again a lifestyle disease condition which has seen a good growth in this last 4-5 years. If you look at over here, monoclonal antibodies, they become the topmost category today. Though they have come in the market relatively recently, but today monoclonal antibodies becomes the topmost segment in the anti-neoplastic segment. Rising cancer incidences, increased patient base, increase in cancer specialty hospitals have improved the access and adherence to therapy. Because earlier patients had to travel all the way to major metros for treatments, whereas now a lot of cancer care centers have come in tier 1, tier 2, tier 3 cities as well. Biosimilars are gaining popularity due to targeted action, dosage convenience, leading to better results and adherence. Entry of affordable generics, whether it is the core antineoplastics or biosimilars, they have improved access. 7 new molecular combinations have been launched in the market. If you see, majority of them are in the monoclonal antibodies segment. Rising cancer incidence, expanding treatment centers, and wider adoption of targeted therapies will drive the oncology market growth. Coming to the ophthalm segment, if you see in this segment, okay, I am taking a little more time in this webinar because I'm trying to cover all the categories. I usually cover only the top 10 categories, but we are covering all the categories today. Strong long-term drivers, that is aging or screen exposure. Dry eye syndrome is something which constantly comes out because we have a lot of screen time, whether it is attending Zoom meetings or being on the computer for a longer period of time or playing on our mobile phones or watching TV. So that is a lifestyle which is leading to these type of problems. And the next category, that is glaucoma, is something which comes out with age. Also, there is a short-term impact, which is growth impact, which is because of procedures linked to, cataract surgeries or LASIKs. Generic competition in this category is also relatively higher. There are 3 molecules or combinations that have been launched in this market today. An aging population and lifestyle-driven eye conditions would sustain stable growth in the ophthalmology segment. If you see, the growth over here in the COVID times, post-COVID times was relatively high, and it has also stabilized over a period of time. Urology segment, if you see, this segment is actually, though in terms of absolute value, it may be a value segment, but in terms of growth, the growth of this segment is actually higher than the cardiac growth in the MAT December period. Cardiac category had grown by 13%, whereas urology is growing by almost 16%. What is leading to this performance of this market? In fact, this is one of the fastest accelerating therapies in the IPM today. Growth is led by BPH and overactive bladder. These become 2 most important segments, and they have shown a double-digit 5-year CAGR as well as a strong double-digit growth in the MAT December period as well. Growth driven by aging male population and reduced stigma in consultation. So, as we talked about earlier conditions of neuro-CNS, people don't accept it as a natural thing which happens with age. But if there is a solution available for these conditions, people are willing to try these solutions and they are willing to pay even if they are expensive. They are not expensive, but even if it is expensive, people are willing to go to a specialist and get treated. Aging demographics and rising male urological conditions combined with lower stigma and higher willingness to seek treatment are driving the growth of the urology segment. Coming to the next category, which is the hormones category. It is the stable and compliance driven growth in thyroid disorders and steroid therapies. Now, thyroid disorders is something which doesn't get talked about much, though medications are there. Abbott has got a very strong product, Thyronorm, in the thyroid conditions, a well established product. But then, thyroid is something which catches up slowly with age, and symptoms are seen, but almost 70% of people over the age group of 50 suffer from some sort of thyroid condition, which may be seen in symptoms like, increased tiredness, slower metabolism. But this is something which we accept that, this happens with age. But then one day, one fine day, the entire body engine collapses, and then we go for a checkup, and then we realize, oh, I had thyroid problem. So early detection is very important, because if you see thyroid hormones, in fact, the MAT December growth is close to 11%. This also is connected with the changing age demographics of the country, where a significant proportion of the people are crossing the age group of 50 and are susceptible to these conditions. The category has got limited innovation, but the demand is predictable, because we know this is the age group that is going to shift from this age group to this age group, and at least 70% of the people will be prone to thyroid related problems. There are no new molecules or combinations that have been launched in the last 2 years. So this segment is a steady growth segment with a predictable demand. Coming to the vaccine segment, if you look, the segment has shown a 20% growth in MAT period. Again, when we look at the growth of this segment, actually it is higher growth 1 year, slower growth next year, higher growth 1 year, slower growth next year, is some phenomena which I've seen in this segment over the last 4 to 5 years. The current growth acceleration is driven by adult immunization, rabies, influenza, and immunoglobulin demand. Because we have seen in between there were certain cases of rabies somewhere in mid 2025, because of which rabies vaccines had also increased. No new molecules or combinations launched in the last 2 years. So there are predictable birth cohorts. So the birth rate of our country would remain more or less same. It was somewhere, just below 1%. So the child population, which would be consuming all the child related vaccines in the first year of birth, that is a stable demand that would be there. Our population, in terms of younger population, with rising awareness and growing emphasis on prophylactic care, that would continue to drive the steady growth in the vaccine segment. Coming to stomatologicals, a category which is very important as far as the personal hygiene is concerned. There is a lot of rising dental awareness. Chronic oral care needs are definitely there. Everybody brushes their teeth twice a day, some people even more. The base is small, but there is a consistent expansion in this base. The entire category has got a strong OTC OTX character. No new molecules launched, but then if I were to talk about a futuristic note, the category is a niche but a scalable segment with strong OTC linkage and self-care driven demand and expansion. Coming to the last few categories now, sex stimulants and rejuvenators. If you look at this category, we may be capturing only a smaller section, because this category has got a good amount of OTC OTX component. So there was a early growth from social acceptance and branding in this category. Now there is a lot of OTC component, e-pharmacy component. There is a lot of nutraceutical competition also that comes in this category. Since there is a reduced RX dependency and many people take it on their own, there has to be a stronger regulatory scrutiny in this set of products. There are no new molecules that have been launched, but then this category had shown an early boom, is now consolidating. Coming to the anti-malarials, which is actually the last category in our a pharma track report, the smallest category, but then an important category. Mosquito bites are happen every year in those monsoon season. So malaria, dengue are seasonality diseases which we see in monsoons or in areas where there is a lot of infrastructure built up happening and a lot of stagnant water. However, there we have seen a lot of successful disease control programs in this area. There is reduced incidence of malaria, and if you we also see a lot of government initiatives in doing a lot of fumigation once the monsoon season comes steps in. And we also see government bodies doing a lot of checkup in different houses to check if there is a stagnant water in water pots or something. So there is a good amount of government initiative that goes into picture to control malaria or dengue conditions. There are no new molecules that have been launched in the market. The segment would continue to be a slow growing segment, seasonality driven category, and would have a limited structural upside. So, this was about how the different categories have behaved. Now, when we talk about how the market would behave in the next year or in the current year 2026, we have used all these assumptions to arrive at the different growths. So when we look at the IPM outlook for the year 2026, this is the current growth that the market had shown. So cardiac category has shown a strong double digit growth. Respiratory has shown a double digit growth. Neuro CNS almost 10% growth. So we expect these categories to have these three scenarios, the optimistic, realistic, and pessimistic. I'll focus more on the realistic scenario where certain categories would continue to show a double-digit growth. While the cardiac category has grown by 13%, why should it not grow by 13% next year? It may not grow as well, but then somewhere the base has expanded. While the patient population may increase, but then we are talking on a higher base. That's the reason why we took a conservative or a little slower growth. As far as the diabetes category is concerned, the diabetes category would definitely grow by 10 to 11%. But then this growth will be fueled more by the GLP-1 agonist. While the GLP-1 agonists have shown a 100% plus growth in 2025, there would be a consolidation now because branded generics would come into the picture and they would actually bring down, while the volumes may increase, the value of the market would come down, or value growth may come down. In fact, we have seen in the last 3 months the month on month growth, which in the earlier times was around 50%, 16%, 50%, 60%. The month on month growth in terms of absolute units has come down to 12%, 15% in the last 3 months. So we are seeing a stabilized consolidation that may happen. Of course, launch of branded generics may again take that unit consumption 2x, 3x times, but that will happen for a limited time period of 2 to 3 months. The other anti-diabetic products, which are the OADs, the insulins, would have a normal steady growth. Coming to the next section, we look at the certain other categories where in majority of the places the growth has been single digit except the urology vaccines over here. When I'm talking about others, we have certain products which hyperkalemia products which come in the other section. A very important molecular combination, zirconium cyclosilicate. This molecule has been launched by Astra in the month of December 25, and this molecule within a month has garnered, the brand name is Lokelma. This brand has garnered a turnover of close to 20 crores in the first month of launch. So these type of products we usually club in the others category because the number of brands and the number of molecules are very limited. So this category in certain sections would show a good growth. So these are the three scenarios that we have worked on. Now, the entire analysis is based on our data sets, which may not be very comprehensive because beyond the pharma trade, there are other channels of purchase. Also, there may be certain institutional components, there may be certain Jan Aushadhi component, there may be certain generic component, which may skew the growth of this market. So the entire analysis that we have done or the numbers that we have projected are based on our data, the data trends, and certain environmental factors which we feel that may be influencing this market. So I may not be 100% perfect on these numbers, but then somewhere I should be close to what we are discussing. So to summarize on these highlights, the Indian pharma market can be broadly segmented into four categories. The first category would be high growth lifestyle led therapies, which will drive the IPM expansion through rising awareness, innovation, launches, and improving access. The second would be demographics driven therapies catering to an aging population, delivering stable and predictable demand. The third would be mature, largely acute therapies characterized by seasonality led demand patterns. And the fourth would be the OTC, OTX oriented categories benefiting from a shift beyond traditional RX channels into modern trade and self care platforms. Now, each industry player, all the pharma players must strategically assess its category exposure, where they are in these sections, and channel mix to fully capitalize on the robust, high potential Indian pharma market. So, across all categories, the growth is really good. Now, it will be certain categories would be high growth, some certain categories would be slow growth, mature. While we cannot be neglecting the smaller categories because all the therapy areas are important for the Indian pharma market, but then we need to really look how we can leverage the our presence in whatever relevant categories that we are present. This was about IPM highlights of 2025 and what 2026 has in store. Next, we go to our normal sections of IPM therapy performance, where I will not spend a lot of time because we have already discussed why the different categories have behaved the way they have. Now, for the month of December, while at the MAT level, the market has shown a growth of 8.1%. For the month of December, the growth has been really good. It's around to 10.6% growth, and the unit growth is also positive. Most of the top 10 categories have shown a double digit growth. I will not go into the reasons why because we have already discussed it in the previous slides. Coming to the growth drivers, if you look at the three growth drivers, volume growth driver is actually positive, which is indicating a strong demand that is getting generated in the market for majority of the categories. It's not just new introduction led growth. Coming to the top therapies, most of the therapies have a positive volume growth except a gastro category, and this is for the month of December, which has got a slightly or a significantly negative volume growth. Coming to the top 40 corporates, Sun, Cipla, Entas, Torrent, Lupin, Zydus, DRL, Glenmark, and USV. These corporates among the top corporates have shown a robust double-digit value growth. In fact, these corporates, they contribute significantly to the IPM, and that's the reason why their performance directly reflects into to the IPM's growth performance. Also, amongst the next set of companies between the rank 20 to 40, Larenon, Ajanta, Indoco, Bayer, and Nutricia have shown a double-digit value growth. Coming to the top 40 brands, while Augmentin and Glycomed GP maintain their number one and number two position at a MAT December level, what we see is Mounjaro, even last month, Mounjaro had moved to number one position. Foracort is at a number two position, thanks to our pollution related problems, which have actually increased the consumption of the anti-asthma COPD products. Other brands like Zerodol SP, Thyronorm, Duolin, Telma, Silacar, they have shown a very strong double-digit value as well as unit growth. In the next set of brands from rank 21 to 40, Levipil, Lantus, Brilinta, Dytor, T-Bac, Levera have shown a double-digit value as well as unit growth. So to summarize the IPM performance for the month of December, the IPM has shown a value growth of 10.6% and a unit growth of 2.6%, with all the therapies showing a positive value growth. All the three growth levers are positive for most of the therapy segments in the month of December. For the month of December, majority of the top players have shown an encouraging value growth. Augmentin and Glycomed GP continue to retain their leadership position at a MAT level, whereas Mounjaro and Foracort move to number one and number two position for the month of December. That's all for today, and thank you for joining us for the webinar on IPM performance for the month of December. I'm sure you would have found this analysis quite helpful and useful for strategizing the year 2026. Thank you so much for joining us today, and have a great week ahead.